Across the United States, quality healthcare remains the cornerstone of a robust society. But in rural communities, access to essential care faces unique challenges. From shrinking insurance reimbursements exacerbated by rising costs to significant gaps in maternal care and emergency services, hospitals struggle to keep vital programs alive.
Some of the challenges that we face in rural healthcare, in Iowa in particular, are related to the rising costs of services and then the decreasing reimbursement that we receive from many of our major payers, including Medicare and Medicaid. That creates financial instability for our organizations, and one of the challenges that we have then is really having to make some difficult decisions about what types of healthcare services we can continue to deliver. And so folks have to travel great distances today to be able to get access to specialty care such as pediatrics. Surgical services are also very challenging. Many of the cardiology services as well, oncology services, are very much a challenge for people to be able to receive in a place that's close to home for them.
In the Midwest, and particularly in Iowa, people want to have the opportunity to have their health care close to home. So I think what works best for hospitals is if we could work on integrating our visiting specialists from outside along with our primary care individuals under the same roof. That allows for less transportation for the patient, a better efficiency in delivering that care, and better patient satisfaction.
Really, since the pandemic, we have faced a lot of challenges in our community as well as across the state and the nation, with a lack of people really wanting to go into the profession to deliver healthcare services. And so we've not only experienced challenges with shortages for physicians and nurses, but as well as the other healthcare specialties such as paramedics. Our technicians that work in lab and radiology have been challenging for us to not only recruit, but to retain as well.
As healthcare providers adapt to rural challenges, innovation is no longer optional. It's essential. By integrating specialists, forging new partnerships, and exploring novel approaches, hospitals are finding fresh ways to bring care closer to home.
At Waverly Health Center, we're really proud of the relationship that we have with our local board of trustees. So we're governed by elected officials here in our community who serve terms, and the relationship that we have with them is imperative. We're blessed here to be a part of the Waverly community as well as to be a part of the city of Waverly, and we're very proud here to be independent as well. And so that allows for decision making to be made at a local level, and so we're able to make decisions by people who live in the community for our community.
Despite systemic adversity, many rural hospitals stand out as strongholds of quality care. In Iowa, Waverly Health Center is a shining example, meeting obstacles head-on with ingenuity and compassion. From unmatched pediatric therapy and imaging services to advanced surgical and orthopedic solutions, Waverly Health Center is redefining what it means to deliver comprehensive care.
At Waverly Health Center, we've been able to adapt to the growing number of changes and challenges that we face in healthcare today, first and foremost because of our staff. Our team is the sole reason that we've been able to make the adaptations that we've needed to be able to remain nimble and viable well into the future, to help ensure that our patients receive the high-quality healthcare that they need and deserve very close to home. In addition, because of our teams, we're very proud of the ability to be able to offer some services that are unique to our community. And one of those services is in regards to pediatric therapy. The last number of years, we've been really working to be able to continue to grow our PT, OT, and speech care services for kids. And being able to provide access to those services for families who need them has been a way that we've been able to work hand in hand with our patients and our families to help allow our children to be able to adapt and grow.
We're very blessed at this organization and our size of hospital to take the time to learn about the patient and provide collaborative care. For instance, a patient that I had, Lincoln, that presented through the emergency department with a spontaneous pneumothorax after going to singing camp and investigating his situation. We have the resources to be able to do that. We go to radiology, we get x-rays, we're checking blood work in order to do a procedure to help with his particular issue. But it very much is a collaborative effort.
When Dr. Ivy was explaining what they think happened and how they would fix it, they were very on the same page. They wanted us on the same page. And if I had to describe my experience with Waverly Health Center, I felt comforted and I felt that I knew everything that was going on with my body at that moment. And I felt cared for. And I could trust the process, knowing that they were doing the best they can.
I was definitely relieved. And I actually didn't have to ask very many questions like I was expecting I would have a lot. You go into his room, he's got a board, you know every single person who is taking care of him and what their position is. Goals are posted right on the board. From the very beginning, Lincoln always knew what they thought happened, what they hoped the best outcome would be. All the nursing staff, they were just very kind and very competent. So everybody that he interacted with showed care and interest in him. They really did show an interest in Lincoln, which was amazing.
Waverly Health Center has been here in the community for well over 120 years, delivering on our healthcare promise to the community to provide high-quality healthcare. And so we're grateful for our founding father, Abraham Slimmer, back in 1904, along with the Sisters of Mercy, who started this organization as a mansion hospital. And so we're very proud of the fact that we've been able to invest in our communities, invest in our facilities, and continue to reinvest in our staff to be able to have the technology and the infrastructure that we need to be viable today.
Waverly Health Center. High quality care, small town comfort. To learn more, visit waverlyhealthcenter.org.